Hello, everyone. This is Greg with CETI. We're going to get started in just a couple minutes. We were just closing up another webinar, so hang on tight, and Jenny will be right with you. There you are. Can you hear me okay?
Hi, Greg. Good morning.
Good morning. How are you?
I'm good. How are you? Day two.
Doing okay. Sorry about that other webinar. I didn't realize that was going right until 9. They were supposed to end at 8:45. So anyway.
Oh, life.
Excellent. Love to get fit, don't quit. Love it.
Then it says in pink, do it.
Excellent. So I'm going to start admitting people. Do you want to see if?
Yeah, I wanted you to see if this was a better. I moved my.
Oh yes, yeah. You have a bunch more space now, so I think that looks great.
Okay, good.
Perfect.
Awesome. And I think my light's okay.
All right, I'm going to get people in here. Just a moment. We have about 8 people, I think.
Wait, and you will be my parrot.
Yes.
Thank you. And you'll be the date again, correct?
Yeah, I'm trying to get you as the
host or
well, at least get you spotlighted.
That's it.
Got everybody joining here.
Okay. Nice to see if people are here live. That's good.
All right. Good morning, everyone. We're going to get started in just a couple minutes. We're trying to get Jenny spotlighted first.
My conference.
There we go. Are you spotlighted now?
I am. Thank you.
All right. I think we got everyone in from the waiting room. Excellent. Well, good morning, everyone, and welcome to the Better Than Ever Life After Breast Cancer live virtual conference. And today we have another session with Jenny Goldberg. And I'm pleased to introduce her. She's got 15 years of experience in health and fitness. An amazing background, and she has an amazing program today, I think, to take you through with a combination of energy and exercise work for breast cancer. So I'm going to turn it over to Jenny and have a great session.
Okay, yes, Greg and Andrea, thank you so much for inviting me to teach for this incredible conference. I feel honored and thrilled to share 2 of my biggest passions with everybody, Pilates and EFT. EFT stands for Emotional Freedom Techniques, and it's also known as tapping, and I will be referring to it as tapping throughout the session today. So before we begin, I want you to get a small hand towel and a tennis ball. I didn't have a tennis ball yesterday, but get a tennis ball if you have one. If you don't, no worries. It's just a little extra prop that we can use today. So that's all you'll need for that. For the first portion, talking about tapping and going through a tapping session, I'll be seated on the floor. If this isn't accessible for you, please just go get a kitchen chair and get comfortable. So I will be seated here for about 20 to 25 minutes. So if that's too long, go get a chair. Okay, so I think that is it. So we'll start with 20 minutes of tapping, followed by about 25 to 30 minutes of a gentle restorative Pilates session, where I will be really focusing on connecting your breath to the movements in your body. After that, we'll come back up and do a quick little mini tapping session at the end to seal in all the good things we've done for ourselves today. So let's get started. So what the heck does tapping have to do with Pilates?
Oh, ow, 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 ow.
Do you mind muting everyone, Greg? Greg, can you do that for me?
Yes, I'm doing that right now. Sorry, I was on mute myself.
That's okay. No worries. Thank you. Okay, so yes, exercise is extremely important for recovery and healing. But what is even more important, in my opinion, is the emotions that are being held within the body and the energy that we are bringing into our exercise sessions. So I've been a Pilates instructor for a little while, and I have witnessed how powerful movement is for healing the body. But I always felt like something was missing, that I could be doing so much more for my clients. They would come in and I could sense their stress, I could sense their sadness, grief, guilt, all those heavy emotions they were bringing into the session. So we would carry on to our sessions we would get into the movement without any sort of acknowledgement or regard for actually how they felt that day. So yes, we were moving, and that is fantastic. So we were focusing on the physical part of the recovery, but we weren't paying any attention to the emotional component of recovery. So I've been a fan of tapping for years, and a little light bulb went off in my head. Why not bring the powerful releasing benefits of tapping into my Pilates sessions? So why not release some of that heavy emotional baggage before we move, so we can move more efficiently, effectively, and freely? So who has heard of tapping? I hope all of your hands are going up. That is my hope, that everyone in the world will hear about tapping. So what is it? To put it simply, tapping is a safe, non-invasive way to change your nervous system. Tapping is scientifically proven. It has over 350 peer-reviewed research studies on the benefits. So it lowers your stress levels and it puts your nervous system into a parasympathetic state. Okay, this is also known as the relaxation response. When we can get our nervous systems to live in that state more often, we allow for a much more optimal healing process. Okay, so how does tapping work? Tapping works on different energetic meridian endpoints on your body. Meridians are a concept from ancient Chinese medicine. So I'm sure you have all heard of acupuncture and acupressure. So those are healing therapies that target the meridian systems in the body. So today we're going to tap on 9 different meridian endpoints on our bodies while focusing on the specific trauma of diagnosis, of being diagnosed with cancer. So when we tap on these endpoints, what we're doing on a cellular level is sending a calming signal through the nervous system to the amygdala in the brain. So the amygdala is part of the limbic system in the brain, and it plays a key role in processing emotions. It's also where the fight, flight, and freeze response is located. So when we tap on these endpoints, while focusing on a specific emotion or problem, we send the signal to the amygdala that it is safe to process these emotions and it's safe to release them. So how can tapping benefit breast cancer recovery? There are hundreds of ways. Tapping can help you release depression, grief, guilt, despair, sadness, anger, chronic stress, chronic weight loss or weight gain. But tapping can also help you to reframe your outlook to look towards the positive aspects of your life. when you're going through something as traumatic as breast cancer, I think it's really important to focus on what's going right and what is good in your life. Dr. Jay Harness had a talk on Monday opening this conference, and he had mentioned the emotional reconstruction that takes place after going through breast cancer. So tapping is a very real, in the moment, easy process to reconstruct and reframe your negative emotions around breast cancer. So anytime we're holding negative emotions in the body, we seriously affect the quality of our life. One of my favorite sayings is, the issues are in the tissues, right? We hold the issues in our body. So tapping really helps you to acknowledge, bring to the surface the issue that you are having around breast cancer, and it helps you to release it. Okay, so it gives you that power. You have the power to release that negativity in your life. Okay, so today I'll go through right now the tapping points. So there's 9 points. So everyone just follow me. So you're going to take your right hand up. I'm using my left hand. It doesn't matter which side you go on in the body, okay? So right hand up. So this is the karate chop point, side of the hand. So I'm just using my 4 fingers here, and you just tap about a medium pressure, not too hard, not too soft. Okay, so this is called the karate chop point. The next point, get a little bit closer, is the eyebrow point. So you see my eyebrow here, this point right at the end, sort of in the bridge of the nose and just right at the edge of the eyebrow. So you can use, I use my middle finger, or you can use 2 fingers, doesn't matter. Okay, so you're just tapping right here. Okay, the next tapping point is the side of the eye, not the temple, not on your eyeball, but that little delicate bone right here, tapping right here. Okay, again, you can use as many fingers as you want. I usually just use 2 here. Okay, the amount of fingers you use on each spot does not matter. Okay, so the next point is under the eye. So just slide your fingers down, so you're still on the bone here, and you're just below, like in the center of the eye, right here. Okay, next point is under the nose. So here's the base of your nose, top of your lip, right in between. You have that little crease here, right in here. Okay, and the next point is under the mouth. So you have that little crease in your chin, right in the middle. Okay, the next tapping point is the collarbone point. So feel your collarbones, come to the middle where you feel those 2 knobs. Just go right below them. And I tend to use just 8 fingers here. Okay, so you're just tapping like this. Okay, the next point is under the arm. So ladies, bra line, this is where your bra line would be. And I just sort of use my flat hand and just right here. Okay. And the final point is the top of the head. So I just put my fingers like this and I just tap on top. Okay, so those are the 9 points we're tapping on. And I said yesterday, there are meanings of why these points are important for the meridian system. I don't have enough time to tell you why each one is important, but you can simply Google tapping points and you can look up why these points have been chosen. Okay, so those are the points. Greg has graciously offered to be my volunteer for this. So how it's going to go, we're focusing on the trauma of diagnosis today. So you may have been diagnosed with breast cancer, or someone you know. It doesn't even have to be breast cancer, any type of cancer. You may know somebody. And if you haven't been diagnosed and don't know anybody who has been diagnosed, just imagine what it would feel like if a doctor told you today that you have cancer. So just bring to mind how it feels to get those words spoken to you that you have cancer. So I want you to find that moment in your mind. And I want you to rate the intensity of that moment on a scale of 0 to 10. So 0 would be neutral, doesn't even matter to you. 10 is the worst case scenario, the worst information that you could ever hear in your life. So somewhere on there, how do you feel about it? Okay, so pick a number. Whatever number comes to mind, the first number is usually your number. We're going to go through a few rounds of tapping, and then we will rate that intensity again at the end. So the goal of tapping is hopefully to lower that number down the scale, to decrease the intensity of the emotion. So tapping really does help people realize you don't have to attach to the emotions directly, that you can remove yourself from it, and it doesn't have to become you. So Greg, you're going to be my guide. And so, Greg, I'm going to go through the points and say certain phrases at each point. So I'm going to say the phrase, Greg is going to repeat it, okay? I start on the karate chop point, and then I'll be moving to all the points. So everyone just follow where I am when I'm tapping and saying certain things. You'll get the gist of it as we go through a couple rounds, okay? So don't worry if you don't remember what I said, or don't even worry about what point you're on, okay? So I'm going to say a phrase, pause for a second, and then you're going to repeat that phrase either in your mind or out loud. Preferably, you will say it out loud, because when we speak, it's just a better mind-body connection. But if you're in a place where you can't speak out loud, just say it in your head, okay? So I've done enough talking. Let's get to the tapping. Okay, so Greg, so everyone, we start.
Ready.
Yep, here we go. We start on the karate chop point with a setup statement. We say 3 setup statements. So I have them in front of me. I have my little script here. Okay, so everyone start tapping karate chop point. Okay, Greg, are you ready?
I'm ready.
Okay, here we go. Even though I was traumatized when the doctor gave me the diagnosis,
Even though I was traumatized when the doctor gave me the diagnosis,
I deeply and completely love and accept myself.
I deeply and completely love and accept myself.
Even though I was traumatized when the doctor gave me the scary diagnosis,
Even though I was traumatized when the doctor gave me the scary diagnosis,
and I think the fear is still in my body,
and I think the fear is still in my body,
I deeply and completely love and accept who I am.
I deeply and completely love and accept who I am.
Even though I feel paralyzed with fear about the future,
Even though I feel paralyzed with fear about the future,
after I was given this diagnosis,
after I was given this diagnosis,
I choose to feel calm and peaceful about my situation.
I choose to feel calm and peaceful about my situation.
Okay, so now we'll move to the points, everyone. So eyebrow point. I'm still traumatized by the diagnosis.
I'm still traumatized by the diagnosis.
Side of the eye. My head was spinning.
My head was spinning.
Under the eye. I am so stressed out about this diagnosis.
I am so stressed out about this diagnosis.
Under the nose. I'm so afraid of what could happen.
I'm so afraid of what can happen.
Under the chin. This scary diagnosis.
This scary diagnosis.
Collarbone. I didn't realize how hurt I would be.
I didn't realize how hurt I would be.
Under the arm. It's so scary when I heard it.
It's so scary when I heard it.
Top of the head. It feels good just to validate my feelings.
It feels good just to validate my feelings.
Back to the eyebrow, everyone. I'm afraid of my future.
I'm afraid of my future.
Side of the eye. What if I get worse?
What if I get worse?
Under the eye. I'm afraid of all the unknowns.
I'm afraid of all the unknowns.
Under the nose. I'm afraid of the pain.
I'm afraid of the pain.
Under the mouth. I am afraid of my symptoms.
I am afraid of my symptoms.
Collarbone. The doctor said it might get worse.
The doctor said it might get worse.
Under the arm. I have all this fear in my body.
I have all this fear in my body.
Top of the head. And I want to let it go.
And I want to let it go.
Okay. Eyebrow. I'm so angry.
I'm so angry.
Side of the eye. How could this happen to me?
How could this happen to me?
Under the eye. Why me?
Why me?
Under the nose. What could I have done differently?
What could I have done differently?
Under the mouth. All the what ifs.
All the what ifs.
Collarbone. They are always running through my mind.
They are always running through my mind.
Under the arm. I wish I could wake up a different person.
I wish I could wake up a different person.
Top of the head. Why me?
Why me?
Okay. Eyebrow again. I choose to accept my diagnosis now.
I choose to accept my diagnosis now.
Side of the eye. I am open to being curious about it.
I am open to being curious about it.
Under the eye. I allow it to be without judging it as good or bad.
I allow it to be without judging it as good or bad.
Under the nose, maybe something good is going to come of this.
Maybe something good is going to come of this.
Under the mouth, maybe it is trying to teach me something.
Maybe it is trying to teach me something.
Collarbone. Lost my spot. I allow myself to feel all my feelings about it.
I allow myself to feel all my feelings about it.
Under the arm, I accept all my feelings about this diagnosis.
I accept all my feelings about this diagnosis.
Top of the head, I allow myself to be with this diagnosis without feeling like I need to run away.
I allow myself to be with this diagnosis without feeling like I need to run away.
Okay, final round, everybody. Eyebrow. My body is a miraculous thing.
My body is a miraculous thing.
It wants to heal and feel at peace.
It wants to heal and feel at peace.
Under the eye, I accept my body for what it is now.
I accept my body for what it is now.
Under the nose, I appreciate all the things it does for me, no matter how small.
I appreciate all the things it does for me, no matter how small.
Under the mouth, I am ready to let go of all the negative feelings about my diagnosis.
I'm ready to let go of all the negative feelings about my diagnosis.
Collarbone, I'm ready to release the anger I have.
I am ready to release the anger that I have.
Under the arm, I give myself permission to let this negativity go.
I give myself permission to let this negativity go.
Okay, top of the head, feeling peaceful, calm, and relaxed as I carry on with my day.
I'm feeling peaceful, calm, and relaxed as I carry on with my day.
Okay, I'm going to take a deep breath in and exhale. Okay, and then you go back to the intensity that you felt at the beginning of the session, and you would rate how you feel now going through those few rounds of tapping. So hopefully the intensities, even if it's just come down half a point, is great. Okay, sometimes people find that, well, either the intensity can stay the same. It's so subjective, of course, but sometimes they feel the intensity actually goes up. And that's actually a good thing because it means that you're bringing something to the surface that needs a little bit more releasing. So the beauty of tapping is you can do one round of tapping. You could go through the points just once, even if you're waiting in a doctor's office and you're feeling all the stress about what he's about to tell you, you can simply tap through the points in 30 seconds. Or you could take an hour and really dig deep on something that's bothering you. So this is the beauty of this, is you can take it from 30 seconds in the doctor's office in the bathroom while you wait for a result, or a full hour at home when you're ready to really, really bring something up and totally let it go. Okay, so I hope you all enjoyed that. Let's get to the breathing and Pilates portion now. So if you are, thank you, Greg, by the way, for doing that. I'm going to start my little timer. So if you are in a chair, you can stay seated in the chair. We're going to do some breath work before we come onto our back. Okay, or if you are in a chair and you're ready to come down on the floor, just come join me, seated position. So let's do a quick tap first. Everyone take your left arm out and you're just going to tap up and down the arm, towards the back, top of the arm, and flip it over. Okay, across the chest. You can tell I love my tapping, everybody. So tapping like this before you move actually helps to wake up the nervous system. It's really helpful for your muscles to be wakened. They're kind of dormant right now. You're just letting them know. Go around to your back if you can. You're letting your muscles know and your body know that you're about to move. Okay, one more time, each arm. Take a deep breath. And you might just even notice, just from doing that, your circulation's improved, your vibration's gone up a little bit more. Okay, so breath. Cancer, I didn't talk about this yesterday, but cancer, any form of cancer, especially breast cancer, where we're talking about the chest, front of the chest wall, can really cause this sort of rounding in. So it's, you've had surgery, your muscles are healing, this contracted position. Even if you haven't had any surgery up here, just the idea of having cancer can really cause your body to go like this because you're protecting yourself, you're bringing yourself in. Okay, so before we do, we're gonna do a little breath exercise. Everyone sit up tall. as tall as you can. I want you to think of the top of your head reaching to the ceiling. So lift your spine up. If you find you're slumping a little, I just want you to lift up, sit right on top of the sit bones, even if you're on a chair. Think of your ribs over your hips, shoulders over the ribs, ears over the shoulders. Okay, pretty good posture. So take a deep breath in here. And exhale. One more time, take a deep breath in and exhale. Now let's find a bad posture. So let's pretend we've had a lot of surgery up here, or we're really just closed off, closed in. So typical posture of a lot of people actually, round your shoulders forward. Okay, allow your chest just to sink. And let's exaggerate it a little bit. I know we're not always sitting like this, but let's pretend you are. So round the shoulders forward, chest is dropping down. Okay, your belly's sort of not engaged, just hanging out. Everyone stay here and now try to take a deep breath in. And exhale. Okay, one more time. Try to get a full breath in this rounded forward position. Okay, so just showing you really, especially with recovery, how important proper posture is, how important it is to open up the chest muscles, because when we're in this position, it's literally impossible to get a full deep breath. Okay, and when we can't get enough oxygen into the body, we're depriving all of our organs, all of our cells of the much needed oxygen. So we need this correct posture. We need to be upright, okay, to facilitate better breath. And one of the first things to work on with someone who's going through recovery and cancer is breathing. Because when we have something traumatic like cancer, it just causes everything to sort of come in, right? It's a shock to the system. So we really need to retrain the system that it's okay to be open. It's okay to open up again. So let's start. All right, so take a deep breath. We're going to go through some different points to focus on when learning how to breathe again. So take a deep breath in, just normal, and exhale. And I just want you to take another one. Take a mental note of how much freedom you feel in the torso, just from here to here when you're just breathing normally. Okay? Just take a mental snapshot of how much freedom do I feel like I have when I take an inhale. Okay, so now let's bring in the Pilates breath. Let's bring a little bit more awareness to how we're breathing. I want you to take an inhale through the nose. And I want you to exhale through your mouth like you're blowing through a straw. Okay, keep that going. We'll do that a few more times. Inhale through the nose. Exhale through your mouth like you're blowing through a straw. So pursed lips. Okay, one more time. Inhale through the nose. And exhale through the mouth like you're blowing through a straw. Good. So now that we have that first part, let's add a little bit more awareness into the core. So your core is not just here. It's here, it's to the sides, and it's all the way around the back. So we're going to do the same. Inhale through the nose, exhale through the mouth. But I want you to focus on this part, the cylinder of your core, contracting in as you exhale. Okay? So inhale through the nose. Exhale through the mouth like you're blowing through a straw. And now everything comes in gently towards the spine. Okay? It's almost like you're saran wrapping. Someone's coming around you with saran wrap around your entire waist. And it's getting tighter and tighter and tighter. Okay? 2 more times. Inhale through the nose. Exhale through the mouth. Everything's contracting in, but gently. It's not a big squeeze. It's more of a slow deflation. Okay? 1 more time. Through the nose. Exhale through the mouth, and everything slowly comes towards center as you try to expel all the air out of your lungs. Good. So the next breath, so now that we have that, let's take our awareness a little bit deeper. So inhale through your nose. Exhale through the mouth, just to reset. Okay, on the next inhale, I want you to see if you can find your inhale and see if you can, as if you were trying to inhale the bottom of your pelvis, your pelvic floor, the part that's touching the floor or a chair. You may not get there, but I want you to visualize the air going all the way down to your base. Okay, let's try that. So inhale through the nose, all the way down. And now exhale, it's coming all the way back up. Actually, a good visual for this I find helpful is thinking of a big red arrow. So as you inhale, so everyone keep breathing as I talk. Okay, so as you inhale, think of a big red arrow going all the way down till it can't go any farther, hits the floor of the chair. As you slowly exhale and everything's coming back to center, that big red arrow is now going back up. Okay, so the breath is going down as far as it can. Okay, we tend to be very shallow breathers. We need to get air into this part of the body. Okay, so let's do that a couple more times. So inhale, big red arrow all the way down. You're filling your whole torso. Okay, exhale, all that air is coming back up as everything squeezes in. Okay, a lot to think about when you learn how to breathe properly. Okay, so soon, if you keep practicing like this, it will become second nature. You'll be much more aware of when you are constricted and when you actually take the time to get the breathing correct. Okay, so one more time. Inhale through the nose, big arrow goes down. Exhale through the mouth like you're blowing through a straw, big arrow is coming back up. Okay, last part. If you have your towel, get it. If you don't have one, no worries. I want to bring a little bit more awareness to the side rib cage, because when I teach people, I find this is an area that is hugely restricted. And this is even just for people who don't have cancer or who haven't had any sort of chest wall disruption. I think a lot of us forget that our ribs, go up into here, and we need that portion of the ribs to move laterally to get the most amount of oxygen into the lungs. So take your towel. This is just a hand towel. Just roll it up so it's a bit thicker, like that. You're going to place it right under your armpit. So your bicep is pressing against. Okay, so I have it under my right arm. We're going to do a few exercises here and then compare it to the left. Okay, so hopefully you feel something after this. So I'm taking my right hand, my right forearm across my body, and I'm just holding it with my left hand. So my left wrist is holding my right wrist. I'm really pushing this bicep into the towel as I take my inhale. So everyone take that inhale through the nose. I want you to visualize this part of your rib cage that's against the towel pushing out into the towel as you push your bicep in. So there's a real opposing force here. So on the inhale, my ribs are trying to push out and my bicep is trying to push in. And then on your exhale, just release all the tension. Okay, let's do that 4 more times. So inhale, it's like you're trying to push that towel away from you with the ribs. And then exhale, release all tension. Okay, 3 more times. Take your inhale. It's almost like you're trying to squish the towel even farther if you can. And exhale. Okay, 1 more, 2 more. I can't count how many we've done. 2 more. Inhale. Okay, posing force. Exhale, release it all. 1 more time. Inhale through the nose. And exhale. Okay, release the towel before you switch sides. Just take your hands to your knees. Even close your eyes, because sometimes you can feel the difference in the body when you take the focus inwards. Now I want you to inhale and feel if you have more movement in this area of the body. Okay, feel if there's just a little bit more, a little more expansion of the ribs on the inhale. I don't know about anybody out there because I can't see you or hear you, but when I take my inhale, I can actually feel my ribs moving, the side ribs moving. Okay, so think about how much more oxygen I'm getting in because now I've created space. Okay, go to the other side. So we'll do it 5 times. Okay, so under this armpit, forearms across the body, right hand's grabbing left wrist. So remember, as I inhale, I'm pushing my ribs into the towel and I'm pulling my bicep in at the same time. And then you exhale, release all tension. Okay, inhale. I normally do this with like a core ball, and I tell people as they're inhaling, try to think of it as a big grape and you're trying to squish it with your bicep and your ribs. So you can pretend your towel is a grape too. So you're trying to squish it and then you release. Okay, 2 more. See, we don't normally think about our ribs moving in this area. So it can become a very, very dormant place. And that's where I see a lot of people stuck with their breathing. right? The ribs have no problem thrusting forward, but we forget that the ribs need to move side to side, and they also need to move forward, forward and back. Okay, so take the towel out. Now let's just put it all together. 3 rounds. Inhale through the nose. Feel now that you might have some more space in these ribs to move out, to increase the inhale. Red arrow goes down, pause. Exhale. Big red arrow goes up. Okay, 2 more times. Even in the camera, I can see that my ribs are moving more. And exhale.
Hi, Jenny. Sorry, I muted you by accident. I think you have to unmute yourself.
All right, there we go. How long was I muted? Did everyone hear what I just said there at the end?
About 5 or 10 seconds.
Okay, so we're good. Okay, so everyone, good job. I hope you got something out of that. I highly recommend the side rib exercise every single day to really facilitate more movement right here. Okay, so come on to your back. Take your towel. You're going to put it as a little pillow. I have a tennis ball. So before I show you some things with the tennis ball, if you're at risk for lymphedema, right, it's bad to have pressure in your upper body or lower body, just omit the tennis ball. But if you're not, if you have one, please try it out. It's not a necessity today, but I am going to show you how you can do a little bit of release work before you move. So come onto your back. And Greg, I'm good. Okay. So everyone can see me. All right, so I have a little pillow under my head. This is just going to help my cervical spine be in better alignment. So the cervical spine is your neck. Tendency without a little support under the head is our chin likes to jut up to the ceiling. So if you're with me and don't have access to a little towel or pillow, just drop the chin towards the chest and think of lengthening the back of the neck. Okay, put my towel back. So first things first, let's check in with our breathing now in a different position. We're in supine, so on our back. I like everybody to take their hands like this into a triangle. Okay, so fingertips and thumbs. Place it right on the front of your pelvis. Okay, so the fingertips are on your pubic bone. The palms of your hands are on both hip bones. So you feel this triangle right here. Okay, so when the triangle is flat, when my fingertips and palms are in the same line, this is neutral position. Okay, ideally we do most movements from neutral, but not always. But it's always good to know what neutral is because a lot of people don't know what that feels like. But this is a good tactile way to know if you're in a neutral position. So let's add in a little pelvic rocking with our breath. Okay, remember we're learning how to connect our breath to movement. So take your inhale. My elbows are just resting on the ground. Take your inhale. Exhale through your mouth and just gently rock the pelvis back. So you're lengthening the lower back towards the floor. You'll notice now your pubic bone, so fingertips are higher than the palms. Okay, and then inhale, rock back to neutral. Pubic bone, hip bones are now in the same plane again. Okay, let's do that a few more times. Inhale through the nose. Exhale, rock back. Think of the abdominals gently engaging. Navel's dropping in, dropping down towards the floor. Lower back releases. Okay, inhale back. Let's do 2 more. Exhale. This is just a really nice exercise to do to release tension through the lower back. Okay. And back. And you're trying to do this without too much tension happening in the thighs. Okay, so really just imagine the pelvis is the only thing really moving on the body. Okay, and back to center. So take your tennis ball now. I'm going to do something called bent knee opener, and this is just a really wonderful way to release a lot of tension through the hips and glutes. We walk around with so much tension here, we usually don't even know it, but this is pretty eye-opening. So you don't have to have the ball, everybody, but if you do, try it. You're going to lift your butt up, and you're going to put the tennis ball, picture your right glute, right in the center, okay? So right where you feel like, okay, there's a little bit of tension happening. So you feel like, okay, the area would be the piriformis. If you know muscles, that piriformis gets pretty tight. So we're finding that place right in the center where it's a little bit more vivid. So now your feet are flat on the floor. We're just going to be moving the right leg. So you found that spot where you find tension. Keep your hands in the triangle. You're going to inhale as you drop that right knee out to the side. So as that weight comes into the ball, you're going to feel a little bit more sensation. Okay, inner thigh is stretching. And then use your exhale. Think of the inner thigh gently lifting back up. Okay, we'll do that 4 more times. We'll do 5 on each side. So inhale, open the thigh. Okay, the left leg is staying stable. The left knee is to the ceiling. Nothing is happening here. And you're not over pressing through the left foot either. So keep the left foot gently on the floor and then back. Okay, 3 more times. So having your hands here on the front of the pelvis, I want you to keep the hip bones level and the pubic bone level. So the pelvis isn't changing. What we're doing is dissociating the pelvis from the femur, from the thigh. Okay. We want to ideally be able to move body parts independently of each other. So if you find when your leg goes up to the side, your whole pelvis wants to go with it, you know there's a lot of tightness happening there. Okay, so I will only really want you to drop this leg as far as you can keep the pelvis in this neutral position. Hip bones, pubic bone are all up to the sky. They're not changing whatsoever. And then back, okay? So that was more than 5, I know. So take the ball out. And just for a second before we go to the left, I want you to feel the difference from the right to the left. For me, my right glute feels like it's way lower than my left. So that just shows me how much tension was being held in the hip and the glute. Okay, so let's go to the left side. So anybody who's a walker, runner, any sort of exercise, this is an incredible thing to do before you do that. It just loosens up the muscles around the joint. Okay, so left leg now, still the triangle in the front of the hips. Inhale, let the left thigh drop out. And then exhale back up, thinking of the inner thigh driving that back in. Okay, inhale, so release. And exhale back up. So we'll go for 5 or 6 here. And you may notice a real difference from left to right. Okay, so when I teach, I really like to do one side of the body at a time because it lets you know where your imbalances are, what you need to work on. Right? We all have one dominant side. It's really good to know which one that is. Okay. How about one more? All right, so you're in the center of the glute with the ball if you have the ball. And you may notice the first one feels like, ooh, like really tight, but as you keep doing this, you start to feel the muscles giving, they start to relax a little bit more. Okay, and last one, take the ball out. And feel your new hips. I can feel that they might have dropped. And you might actually feel when you've released the hips and glutes here, your lower back is now a little bit closer to the mat because it's released as well. Okay, so let's move to some movement of the leg while focusing on the core. So remember, we're trying to connect our breath to the movement. So again, hands on the front of the pelvis. Take your inhale through your nose. Exhale through your mouth, and as you exhale, use the exhale to bring your leg to tabletop. Okay, and then inhale back down. And we're going to do alternating legs, everybody. So inhale here, and the exhale is what you are using to bring the leg up. Okay, inhale down. So keeping your hands here, keep going, everyone, at your own pace. As you exhale, I want you to feel the abdominals below your hands in that triangle, dropping down and in towards the floor. Okay, and lower back down. With core dysfunction, I often see people when they like lift a leg or something, their abdominals push out, right? That's not helpful for your back. To support the back in any movement, we want the abdominals always drawing in. Okay, so this is a really good exercise to see what's happening in your abdominals as you move a heavy limb like your leg. Okay, inhale down one more time each side. Exhale. And as you're doing this, you're noticing, hopefully, that your hips are not moving. Your pelvis isn't shifting side to side. It's not dropping down. It's staying stable as you move each leg separately. So you want to think of this sort of hinging in the hip joint, really. Okay, this is a good exercise, beginner exercise to learn how to hip hinge again. Okay, and exhale, last one. Good. So let's give our upper body some attention. So get your tennis ball again. Now I want you to place that tennis ball just so you know where your shoulder blade is. We're on the right side, right on the medial border. So between your spine and the medial border of your shoulder blade. So find that spot. Okay. I think it's pretty evident where we hold tension here. You just have to put the ball there and you know immediately. So find a spot where you feel tension. Okay, and I just want you to move your arm in any way that feels okay for you. Okay, so it can be across, okay, overhead, down, and of course you're never doing, if this shouldn't be painful. So if you're finding this is painful, just take the ball out and you can just still move your arm around, okay? So we never work through pain, not a good thing. But I think we can all, we all know the difference between pain and being uncomfortable. Okay, pain is bad, being uncomfortable is sometimes okay. Okay, so a few more. Okay, and I want you to take that ball out and just lie for a second. And I want you to feel the difference on the right to the left. So I feel that my right shoulder blade is actually flat to the floor now. Okay, the left feels like it's a little bit lifted up. Okay, so it's amazing what you can do in like 20 seconds with the ball. So to release the tension before you move is really important. Okay, so back over to the left. We'll just do this quickly. Okay, we can't neglect the other side. So find a place medial border of the left shoulder blade between the shoulder blade and the spine. Okay, so you're not on the shoulder blade bone, you're in the muscles between the spine and the shoulder blade. Okay, and if this is also something you can do at the wall. Okay, if you need to stand up, you can put the ball behind you and roll around. It's amazing also how much tension we hold in the shoulder blade area, especially when we have that kyphosis, that rounding forward. These muscles get overstretched and they're weak. Okay, so this also helps to wake them up before we start to work them. Okay, and that's good. So take that out and now I feel personally, both my shoulder blades are flat to the floor now. Okay, so let's do just a few arm movements and then we're going to combine our legs and our arms. Okay, so arms up. Let's do some protraction and retraction. So I want you to inhale as you reach your fingertips towards the sky. Feel the shoulder blades move away from the floor. That's on your inhale. And then exhale through the mouth gently and bring the shoulder blades back towards the spine. It's almost like you're trying to squeeze your yoga mat behind you with the shoulder blades. Okay. Inhale, think of your shoulder blades wrapping around the ribs as they try to go up to the ceiling. And then use your exhale. They come and wrap back around the rib cage. I find this is a tricky move for a lot of people because we sometimes forget that our shoulder blades are actually supposed to glide around the rib cage. Okay, so reach, reach, reach. So nothing else is changing in my body. I'm just thinking of moving the shoulder blades on the rib cage. Okay, notice if you're holding tension anywhere else. Okay, try to keep the feet light, the legs light. If you're holding tension here, just see if you can relax. And down, one more. Okay, inhale, so lift up. And exhale, back down. So moving to T arms, inhale out to a T. I want you to hover your arms an inch over the floor. Okay, hold them here. Feel all the muscles working in the arms and chest. Okay, you might feel one side of the chest is tighter than the other. Good to notice what's happening in your body. And then use your exhale to close back in. Okay, 4 more times. Inhale, expansion. So you're hovering the arms, you're not dropping them down. So actually, everyone just drop them towards the floor. Drop them on the floor. You'll feel how everything just turns off. We always want to keep those muscles on. So just an inch or two, and then exhale back. Okay, inhale out. Exhale, close. Inhale. And exhale. Okay, let's put some legs and arms together. Take your right leg to tabletop, left arm up. So the right hand can just be on the floor, left foot is on the floor. Okay, we're just going to take this left arm overhead and the right toe towards the floor on an inhale. And then I want you to exhale bring them back to center. Okay, so we're gonna stay on this side, keep that going. So as you inhale, take your right hand to your left rib cage. I want you to notice what's happening there. What we don't want is the left rib flaring open to help you get the left arm overhead. So you're only going to take your left arm as far back as your left ribs stay in line with the left hip bone. Okay. Okay, and if you have any shoulder issues at all, you only go as far as it's comfortable for you. Okay, and you'll notice from my left shoulder to the right hip, you'll feel this oblique sort of line, this diagonal line of the muscles having to work. Okay, this cross body pattern, very important to train that. Inhale back. Exhale, think of the abdominals dropping in towards the mat. Okay, one more. And exhale. Okay, switch sides. Left leg up, right arm up. Excuse me. And here we go. Inhale. So take your left hand to the right ribs. And exhale back. Okay, you might feel like one side's a lot stronger than the other. One side might feel harder to do than the other. That's very normal. Right, we're all stronger on one side. Okay, we're going to do 3 more. So I like to keep my hand on the rib cage because I was a notorious rib flarer for my upper body movements. My ribs loved to flare up towards the ceiling to help me get farther with my arm. So the ribs sort of try to help the shoulder joint. So we don't want that. We want the ribs to stay in optimal alignment with the hips. So I really find the rib cage dictates how far the arm is actually going to go. Okay, it's just really good. I love to have people keep their hands on their bodies so they can be aware of what they're doing, what their compensations are for movements. Okay, one more. And you'll notice just keeping your leg up like this, just holding tabletop is a lot of leg work. Okay, good. So one more move here. Sorry, I'm just going to check my time. Okay, we got it. All right, so challenge move, everybody. So take your right leg to tabletop, right arm up. So we're on the same side, right leg, right arm. So now we're going to take that right arm out to a T like we did, and we're going to drop this tabletop shape out to the right as well. Okay, so you're going to feel a lot of work on the left side of the body. Keep your left hip heavy, and then use your exhale to come back up. Okay, 4 more times. So you're going to go out and you're only going to go as far as your left hip stays, left glute actually stays on the floor, and come back in. Okay, this is a huge challenge for the left side of the body. Inhale out. Whoa, exhale in. That's really hard. Okay, 2 more. Inhale out. Pause the second, maybe for a second longer than you want to really feel what's having to work to hold the limbs out like this. And then the exhale, belly drops in. Okay, 1 more time. Good. You'll notice probably, hopefully you're starting to shake. I am. And then exhale back in. Okay, take them down. So left side, left leg tabletop, left arm up. There we go. So you inhale out. Okay, only going as far as the right glute can stay on the floor, and then exhale back. And really take notice, so we'll do that 4 more times. Really take notice the difference from this side to the other side. Okay, I know my right side is stronger, so this is not as much of a challenge for me to hold these legs out here like this, the leg and the arm out like this. Good. Exhale in. So when I teach people this, I call this fundamental Pilates, really. It's really eye-opening for them to realize how much they've been moving throughout their life without actually connecting the breath to what they're doing. What I notice a lot is people are just always holding their breath. Okay, not functional for the core, not good for your back. So it's really good to retrain the nervous system, retrain the muscles, retrain the mind, retrain the ribs, the core, everything to move as a unit, move together, okay, to bring function back to the body. Okay, so take that down And I think we have time for maybe one more move. All right, let's do some articulating bridges just to get some movement through the spine because we've been flat for a little while. Okay, so bridging, love bridges. Articulating bridge. Again, I like to have my triangle on my pelvis just to be aware of what's happening in the pelvis. So you're going to take your inhale. You're going to exhale. You're going to rock the pelvis back like we did at the beginning and feel the lumbar spine, your lower back, moving towards the floor. When you can't go any farther, start to press into the heels and keep rolling up the spine to get to the top of the bridge. Everyone pause at the top of your bridge for a second. First things first, the weight should be between the shoulder blades. So you should be able to lift your head up off the mat because the weight is not in your neck and not in your head. I apologize, everyone. Take your towel out. If you have the towel under your head, just take it out. I didn't say that. Sorry. Also, I want you to think of the ribs. Take your hands to your rib cage. Where are they in relation to the hip bones? They should be flush. Okay, my ribs should not be above my hips. Okay, take your attention to your hip flexors right here. I want you to think of lifting them up to the ceiling. And to do that, you're thinking of your knees reaching towards your toes. So the weight is shifting this way, not this way, towards the feet. Take your attention to your feet. Press through your big toe, little toe, middle of the heel. Good. And then think of the glutes squeezing and lifting. Good. Now inhale and think of the ribs expanding side to side. And then slowly exhale as you roll down one vertebra at a time, starting between the shoulder blades. And think of each vertebra getting a chance to tap down. Okay, really feel what's happening in your back. Okay, lumbar spine touches down, and then you're rocking your pelvis back to that neutral start. Okay, we'll do that 3 more times. Take your inhale. Exhale, rock back first. When you can't go any farther, start to lift up one vertebra at a time, all the way up. Weight stops between the shoulder blades. Self-check. Where are my ribs in relation to the hips? Can I open the front of my hips a little bit more by thinking of lengthening my quads and kneecaps towards my feet? Think of pushing through my big toe, little toe, middle of the heel. Can I engage my glutes a little bit more? As I inhale, can my ribs move side to side? As I exhale, can I start between the shoulder blades and tap each one down, each vertebra one at a time, slowing this bridge down as slow as you possibly can. You realize how much work is happening and I'm hardly moving at all. Okay, one more time. Make this your slowest bridge yet. Really feel what's happening in your body. I find a lot of people that I've seen and trained just want to rush through things. So take a second and see what's going on in you. Okay, so inhale, exhale, rock back. Right, you may find that, and keep going, you may find it's hard to touch down in a certain portion of your spine. Okay, so take your attention to that and realize, right, the spine should move freely. It should articulate. But we really get in these stuck patterns that I guess our spine gets stuck and then everything else has to compensate around the lack of movement there. So I find these bridges are a really good awareness to where your spine feels stuck. Okay, so you're inhaling at the top into the ribs. Okay, hip bones in line with the ribs, reach through the thighs, inhale. And then exhale, slowly dropping down. Another way to think about this is your rib cage is dropping towards the floor before the hips do. Okay, and really slow down through the lumbar spine because that's an area that we tend to just kind of clump down in and then rock back to neutral. Okay. All right, good everybody. So come on up, take a second. Whew, we've been on our back for a while. Good job. Hopefully you learned something. And now we will do just a quick, short little tapping round to show some gratitude for our bodies, for showing up today, for trying something different, for keeping an open mind. I feel like we don't give ourselves enough credit for all the things that we can do and that all the ways that we are showing up for ourselves in our lives. So here we go, everybody. Let's start with the karate chop point. Okay, so you're tapping here and you're going to repeat after me. In this moment, I choose to slow down, relax, and be present. Okay, I let go of any stress, worry, or distraction. I open myself up to this feeling of gratitude now. And I choose to settle into gratitude now. Okay, so eyebrow point, feeling gratitude in my body now. Side of the eye. Life doesn't have to be perfect to be amazing. Under the eye. Right here and right now, there is so much to be grateful for. Under the nose. I welcome this opportunity to slow down and be grateful. Under the mouth, feeling all this gratitude in my body now. And collarbones. The more I practice gratitude, the more I have to be grateful for. Under the arm, I choose to thank my body now. Okay, top of the head, feeling gratitude in every cell of my body now. And one more, I choose to be happy now. Okay, and you take a deep breath in and relax. And good job. Thank you everyone for coming today. I appreciate it. I hope you got something out of it. And thank you, Greg, for being my volunteer.
Thank you, Jenny. Wonderful.
Thank you. Okay.